Hello, students. I wanted to give you some feedback regarding your breathing pattern case study that you completed. We're going to talk a little bit about the patient, James, who's 9 years old, who comes into the pretty much the emergency room with a pulse ox that's 88% on room air. He's short of breath. He's got lung sounds that are pretty much absent in the bases and course bilaterally throughout the rest of his lung fields. Okay, he's unable to sleep from coughing. He's coughing up thick yellow sputum. He has a respiratory rate of 36 per minute, so he's tachypnic. He's restless and fatigued. Okay, so when you look at all of his symptoms and you think he's been having problems where he's been in the ER, a lot of you talked about that with your first question, what was going on with him, what were some of his concerns that made you think, wow, this patient's not doing well. And we do know that kids do get sick. They can get up to 6 to 12 infections throughout the year, but he's been in multiple times, as the case study says. So you do start to worry if there's some kind of immune deficiency going on, if he's just not able to fight things really well. So as you go on, it talks about doing ongoing outpatient and inpatient assessments. The thing that you want to do is if a patient's hospitalized with any kind of pneumonia, which we think this patient does have pneumonia because he definitely has what's called consolidation, which is located in the lower bases of his lungs, probably because the infection has built up, which is a classic sign of pneumonia. And you can actually see that on a chest x-ray in patients who have developed pneumonia. Okay, so when you think of things that you want to do, the biggest priorities is you definitely want to continuously watch his pulse ox. You're obviously going to apply oxygen to the patient via nasal cannula. Make sure it's put on correctly where the prongs are in his nose and that it's wrapped around his ears and fitted up to his neck. You definitely want to make sure that you do assess his skin, because whenever you're putting any kind of tubing around the ears, you can definitely get skin breakdown behind the ears. So if he is wearing this for a longer period of time, usually I even say even in 24 hours, you could develop some kind of skin integrity. But we definitely want to put oxygen on him, and we want to continuously monitor his pulse ox to get it above 92%. And when you apply oxygen, usually start off with 1 to 2 liters. You can go up to 6 liters on a nasal cannula. After that, you would have to go to a mask. So for him, you would definitely want to apply oxygen for the goal to get his pulse ox above 95%. Okay. The other thing you'd want to do is definitely assess his lung sounds probably every 4 hours. He is definitely going to be started on antibiotics, probably IV antibiotics. And usually they would do a stat sputum culture where they're trying to figure out what antibiotic to put the patient on. And Honan talks about this, how important it is to do what's called a stat sputum culture. It's very important to do for patients, especially in patients who have pneumonia, or we think that they have pneumonia. So you will see that they will do this so that they can figure out what type of antibiotic to put the patient on. So it's actually called a stat sputum gram stain may be obtained. And this will help so that we don't put them on the wrong kind, and that it's the antibiotic that we have them on becomes resistant or is not going to fight the infection. So we want it to be sensitive to the antibiotic, not resistant. So that would be one of the big things that we would want to be starting him on immediately. Assessing his lung sounds, assessing his vital signs, definitely his blood pressure, his heart rate, his respiratory rate, and his temperature probably every 2 to 4 hours. Okay, these would be things that we would be assessing. We definitely would be starting an IV. We would be assessing his hydration status too, because as we know, patients with pneumonia usually have no desire to eat. So we definitely might have to start IV fluids. They don't have desire to eat. They usually don't have desire to drink, especially if his respiratory rate is 36. He definitely can become dehydrated just because his lungs are working harder to inhale and exhale, which will lead him to a dehydration state. So we probably would have to start some IV fluids for him and monitor his intake and output. So those are the big things to think about. We also would look at his skin color, signs of cyanosis, depending on, his culture and what his skin tones are. You would have to look maybe around his lips, maybe if he, you might be able to look on his face. We definitely would be doing capillary refill. We'd also assess his lethargy, if he's lethargic, if he's tired, because most 9-year-old boys, I would think, would be pretty active. So we definitely would want to assess that, and his level of consciousness. We could also ask him, how he's feeling. Does he feel really lethargic? Does he feel tired? Or ask his mom. Sometimes patients won't always tell us that. The other things that we want to assess on an outpatient after he gets sent home is to make sure that his mom is assessing him to see if he, it's his temperature, if he starts to have fever, chills, if he starts to feel more lethargic, if she starts to see cyanosis. So we'd have to teach her how to look for signs of cyanosis around his lips, look at his respiratory rate, if he's using accessory muscles, does he feel like he wants to sleep all the time? If he's eating and drinking, those are also signs that the pneumonia might be getting worse and that the antibiotic that he's sent home with is not effectively fighting the infection. So definitely that. Most patients don't have a pulse ox at home. They don't use a continuous pulse ox. So they would not have that availability for them at home. So if he goes to the doctor's office, they would be checking his pulse ox and making sure it was adequately above 92, 93%. So the other thing is to talk about teaching. So a lot of you talked about that he would have to know the kind of antibiotic he's on, know what type of, how to take the antibiotic, but also the important thing is that he completes the full course of the antibiotic, because resistance is a big issue. And what happens is the patient starts to feel better and they stop taking the antibiotic. So the parents stop giving it to the patient, or the patient stops on their own if they're above 18. So he needs to finish the full course, even if he is not, even if he is feeling better. So also thinking about side effects. So you have to think a lot of antibiotics have side effects. They can cause super infections. They can cause C. diff. So patient's family, well, in his case, it would be his mom. She would need to know the side effects of these medications. Also, if he had an allergy, if he started to have an allergic response to the antibiotic, what he would do in that situation. He might have to go back to the ER, or he might just have to call his doctor if it's just hives. And then they'd have to take him off the antibiotic, put him on something different, and then also treat the allergic reaction. So just keep those things in mind, because all of that stuff we do need to teach the patient, whether it's him or his family. It's important to teach him that. The antitussive that he's been given, that's to help him so that he's not coughing at night, because we do know how important it is to get rest and promote adequate rest for somebody who has pneumonia. And if he doesn't get adequate rest, he is not going to heal. So that's why the doctor probably was ordering that. And then when you go down to the nursing diagnosis, most of you are putting impaired gas exchange related to lung congestion, secondary to pneumonia. But he definitely has impaired gas exchange, and it is related to if you think about what's going on in his lungs, it's related to the fact that he cannot have good gas exchange because he has an infection in his lungs. They're not able to have that good perfusion and ventilation. So, and his as evidenced by would be that he has a pulse ox of 88% in room air, that his lungs at the bases, there's no lung sounds at the bases, you can't hear anything, and that they're coursed bilaterally through the rest of his lung fields. And then he's short of breath, he's unable to sleep at night because of the coughing. He's coughing up thick yellow sputum. He has a respiratory rate of 36, which is tachypnic. So those are all your as evidenced by. Please remember that it has to be 3 parts. I've been trying to explain this to all of you, and I do see that you're using the nursing diagnosis, but you have to have the related to, and then you have to have the as evidenced by. And then interventions, we have to think about what interventions we could do for the patient. And there's a lot of great interventions that we could do. We definitely could teach the patient to cough and deep breathe to help open up those lung fields. We could teach them how to use an incentive spirometer, which we all nurses should know how to use, which would open up the lung bases and help him cough out that thick yellow sputum, that infection that is in the bases of his lungs. We also could teach him proper hand hygiene, which a lot of you have talked about. Those are great teaching strategies, that he would learn how to wash his hands, and also that he would cough up the sputum in a Kleenex and then throw the Kleenex away in a garbage can and then wash his hands after he does that. And that's just to keep, the infection from, being passed on to like another family member, or I think he had a sister, actually, a younger sister. So those are good things to do. Another student put down maybe some respiratory treatments. Sometimes we do give respiratory treatments to patients. We're talking about albuterol, Atrovent, nebulizers. However, those are usually given when patients have what's called wheezing or tightness in their lungs, and that's to open up their lung fields. So sometimes we do give those to help open up the lung fields if we feel it's necessary. And that will help him cough out that thick sputum. Also, we talked about interventions would be IV antibiotics, definitely monitoring his pulse ox, because when we think of interventions, we think of assess, treat, and teach, which I talked about in my previous video. And so we definitely would want to assess his pulse ox, and probably assess it every 2 to 4 hours, assess his vital signs every 2 to 4 hours. We definitely would want to make sure that we give him his antibiotics. We also might think about IV nutrition, making sure that he could maybe take in some protein shakes, make sure he's drinking like fluids that have electrolytes in them. That would help his nutrition. And also we might have to start an IV if he's not drinking enough fluids. So we might have to start some IV fluids for him and then put him on strict intake and output. So I just wanted to give you good follow-up on this so that you know and understand pneumonia. It's very important you understand it. It's you're going to take care of patients in the hospital with it, and it really is gas exchange issue, and it's also an ineffective airway clearance issue. So if by some chance James wouldn't be able to cough things up, then we would have to think about suctioning him. Either nasopharyngeal would be suctioning, or if he could cough it up but couldn't spit it out, then we would have to use the Yonkar suction, an oral suction, to get the sputum out. So just keep this all in mind as you are working with pneumonia patients. The other intervention that I thought of and I talked about And in my responses to you was we could use chest PT, which is chest physiotherapy, to help mobilize those secretions and get them so he could cough them up. That is another intervention that we could use. So I hope this helps, and I hope you have a good night. And if you have any questions, please reach out. Thanks. Bye.